Welcome to Mapping Your Journey. The focus of this webinar is on the stages and progression of dementia. This webinar is designed for care partners of someone living with dementia, as well as individuals living with the cognitive changes brought on by dementia themselves. Before getting into the content of today's webinar, I want to acknowledge that the topics I'll be discussing can be hard to hear about and may have an emotional impact for you. You may already be expecting this, and in some cases, it may catch you quite by surprise. Know that grief and loss are passengers that accompany the dementia journey. Sometimes they'll be quiet and you can find happiness on the ride, and sometimes they'll be so loud it can be hard to focus on anything else. If you find you'd like to speak with someone for support, or if you're interested in learning about the programs and services the Alzheimer Society of BC has available, please don't hesitate to give the First Link Dementia Helpline a call. The number for the helpline is available in the description of this video and will also be displayed at the end of the webinar. This session is called Mapping Your Journey because of one of the most common questions we hear at the Alzheimer Society. What can I expect for the future? What's going to happen down the road? It can be really frightening to not know what to expect along the dementia journey, and uncertainty is often a very uncomfortable feeling. While we would love to be able to provide one clear, definitive roadmap for the journey, the truth is no two routes are exactly the same. Think about traveling from one side of the country to the other. The destination may be the same, but there are many different routes that can be taken, and you never know exactly what might come up along the way. What we can discuss, however, is some of the signposts you might see and stops you might make along the way. This webinar provides an overview of dementia, a look at some of the warning signs or earliest symptoms, and an outline of some of the things you might expect through the different stages of dementia. Even though each person's journey will be unique, we hope this helps ease some of the uncertainty and gives you an idea of what the road ahead may look like. To start, let's answer a foundational question. What is dementia? Dementia is not actually a disease itself. Rather, it's a broad medical term or umbrella term used to describe a collection of symptoms indicating physiological damage in the brain. The symptoms associated with dementia include memory loss and difficulties with thinking, problem solving, or language. Now, everyone can experience these symptoms to some degree at some times. Dementia is considered when there's a combination of these symptoms severe enough to impact a person's ability to perform everyday activities. Changes in mood or behavior are also common symptoms you might notice. Dementia is a progressive condition, which means that the symptoms will get worse over time as more brain cells become damaged and eventually die. This also means that brain changes can be happening for many years before the symptoms associated with the damage become noticeable. Under the umbrella of dementia, there are many different specific diseases that cause the symptoms associated with it. In fact, the term dementia covers more than 100 different diseases. Some of the most common being the ones you see the characters on this slide naming: Alzheimer's disease, vascular dementia, dementia with Lewy bodies, frontotemporal disorders, and mixed dementia, which happens when someone has more than one disease impacting the brain, like Alzheimer's disease and vascular dementia together. You'll also notice one of the characters simply saying, "My doctor says I have dementia." Sometimes a doctor might just provide a diagnosis of dementia, recognizing there is brain illness causing the presenting symptoms, with no specific diagnosis as to what disease is actually causing the dementia. Another diagnostic term that's become more common is neurocognitive disorder. This, again, acknowledges the presence of a disease causing dementia without specifying which disease it is. So, every character you see here, aside from the last one discussed, is using an accurate, specific term for a dementia. The character saying, "My doctor says I have dementia," is using an accurate but non-specific term. Another way you can think about the difference between dementia and a specific disease, like Alzheimer's disease, is to think about the umbrella term for a different type of illness, like cancer. We know there are many different types of cancers, and we understand intuitively that bone cancer is different from skin cancer, even though they both fall under the same umbrella term. For example, if someone says they have melanoma, you know they have cancer. But if someone just says they have cancer, you won't know what type it is unless they tell you. This is similar to dementia. If a person has Alzheimer's disease, you know they have dementia. If someone says they have dementia, you don't know if it's Alzheimer's disease, Lewy body, vascular dementia, or a frontotemporal disorder. So even though there are many different diseases that cause dementia, and each person who has dementia is different, what they all have in common is dementia. At the Alzheimer's Society, we sometimes hear, "It's not Alzheimer's disease we're dealing with, so can you really help us?" Alzheimer's disease is the most well-known form of dementia, and that's one of the reasons why you often hear the terms being used interchangeably. Even though we're called the Alzheimer's Society of BC, we support individuals affected by all forms of dementia. Turning attention back to thinking about the dementia journey map, we'll be looking at the progression of dementia through stages. Let's think back to that first analogy of the dementia journey as just that, a journey, a trip from one place to another. Every journey has a preparation phase, a beginning, a middle, and an end. Even when the start and end points are widely shared, the path you take is uniquely yours. We're not providing a specific route you'll take, but rather providing a map of different possibilities. There are two widely used models of dementia progression you might hear referenced. One of these is the Riceberg's Global Deterioration Scale, which consists of 7 major stages. This scale is often used by clinicians and in care settings. The other common model is a 3-stage model, where changes are referenced as either early, middle, or late stage, or perhaps mild, moderate, or severe dementia. The reason I mention both these scales is to provide some context for different terms for stages you might hear referenced by those on your healthcare team. Some people have been confused and alarmed to hear a doctor reference someone's current stage as stage 3. Thinking only about the model you see represented on this slide, someone could easily be shocked thinking stage 3 was referencing late stage dementia, when on the Riceberg scale, stage 3 represents mild cognitive decline. We hope knowing about these two models helps you better understand or feel more confident asking questions if a healthcare provider says something to you about a stage of dementia. For this webinar, we're going to look a bit more at the symptoms of progression through the lens of the 3-stage model and a few of the stops or points along the dementia journey. This graph is quite general and broadly covers all dementias. While it visually maps out a few of the many stops, there are 2 important caveats to take into account. First, the scales are general and broad with a significant amount of overlap. Second, as we've already highlighted, dementia looks different for each person and each type of dementia. If you've met one person with dementia, you've met one person with dementia. No 2 people will experience dementia in the exact same way. This means that not everyone will make these stops in this order. For example, this graphic isn't suggesting someone should wait until the middle stages to start planning for the future or accessing support services. Planning ahead and connecting with services is often best done in the early to middle stages, so that the person living with cognitive change is able to communicate their wishes and be actively involved in the planning process. It's never too early to start planning, and it's actually something we should all consider doing regardless of dementia, as we never know what's to come in the future. So, personal planning conversations are best had early and revisited often. This just highlights that if someone is in the middle stages, this is the window of opportunity you really want to make sure planning is done in. I'll also note that while a diagnosis often occurs in the early stage, it can be made at any point along the dementia journey and may even change as the disease progresses. To start at the very beginning of the progression scale, there are 10 major warning signs that dementia may be present. Before getting into these, though, there's some things to keep in mind. First, this chart is not a diagnostic tool, but it can be a very helpful reference point. The symptoms we'll discuss can be experienced by anyone to some degree at different times. In many cases, that doesn't mean there's a dementia present. When someone experiences multiple symptoms to the degree they affect a person's daily life and activities, that is when a dementia might be present. Second, there can and will be individual differences in warning signs and symptoms. Each person is unique in what they're experiencing, even when there are many similarities. And finally, there are other conditions, such as depression, drug interactions, and infections that can present with some of the symptoms of dementia, despite them not being a dementia-causing disease. These conditions can cause delirium, sometimes referred to as a reversible dementia. So it's very important to see a doctor and get the correct diagnosis and proper treatment when there are concerns about your or someone else's cognition. The most commonly known warning sign is memory loss. Someone may forget things or may have difficulty recalling recently learned information. There can also be difficulty performing familiar tasks. Someone may find it challenging to complete a familiar task, like playing a favorite game or driving to a familiar location. Language problems are common. There might be difficulty finding the right word. A word related to the word someone wants to use may be substituted. For example, saying book instead of newspaper. Or someone might describe or talk around words instead, perhaps saying wrist clock instead of watch. There can be disorientation in time and space. A person may lose track of days and time. They may also forget where they are, how they got there, or how to get home. Impaired judgment is another sign. A person may experience some changes in decision-making or judgment. For example, they may not be able to identify how fast they should be driving on the highway. Or they may go outside in shorts and a t-shirt in the middle of a cold winter's day. Problems with abstract thinking can be one of the early symptoms experienced. Someone may have difficulty with tasks that require abstract thinking, like keeping track of monthly bills. They may also have trouble knowing what the numbers mean or what to do with them. Misplacing things can also be common. A person may lose things and have a difficult time retracing their steps to find them. They may also put things in unusual places, like ice cream in the cupboard instead of in the freezer, or keys ending up in the fridge. There are also changes in mood and behavior. Someone may experience rapid mood swings, from calm to tears or to anger for no clear reason. And changes in personality. Someone may become depressed, suspicious, fearful, or anxious. Family members and friends may notice the person is acting out of character. You might also notice a loss of initiative. Some people may appear to be withdrawn and disinterested, and may need some cues and prompting to become engaged. These symptoms can be very challenging, practically and emotionally. If you could use any information or support on how to cope with these changes, please call the First Link Dementia Helpline or visit our website. We are here to help. And while you can connect to us at any stage in the journey, it can be particularly helpful for you to connect earlier so we can support you through the various paths you take on your journey. If you or anyone close to you is experiencing any of the warning signs and symptoms, it's a good idea to see a doctor for assessment. With early diagnosis, you can receive help with understanding and adjusting to the diagnosis, get access to appropriate treatment and support, and plan for the future. A family doctor is usually the first contact when there are concerns about cognitive abilities. The family doctor may make the diagnosis themselves, or they may refer the person with the symptoms to a specialist, which could be a neurologist, a psychologist, a geriatrician, or a psychiatrist. If you don't have access to a family doctor yourself, call the Dementia Helpline and we can discuss how to start the diagnosis process. There is still no definitive test for diagnosing Alzheimer's disease or other types of dementia, though specialists are able to be quite accurate. As discussed a few slides back, symptoms of dementia can be similar to symptoms of several other diseases. The diagnosis of dementia is made through a systematic assessment that rules out other possible causes. Some things you can expect through the diagnosis process are a thorough medical history being taken, tests to assess cognitive functioning, like the Mini Mental Status Exam or the Montreal Cognitive Assessment, a physical exam, lab tests are ordered, imaging through a CT scan or MRI is often done, and there are also psychiatric and psychological evaluations to rule out other conditions like depression. I want to highlight and acknowledge that the process of diagnosis can be time-consuming and complex, and even after all the assessment, the diagnosis may still be conveyed as probable or possible. For tips on how to prepare for a doctor's visit, there is a link to a Getting a Diagnosis toolkit in the Helpful Resources document linked in the description of this video. For some, the diagnosis symbolizes the start of the journey. For others, the diagnosis can help make sense of things that were noticed long before there was a significant concern. A caregiver once shared with us how, looking back, her husband's earliest symptoms were like the sound of nearby rail lines, which begin to sing well before the train is actually in view. The start of the dementia journey she and her husband were on had started before they knew they were on it. Both she and her husband began to notice that something was wrong, but as many people experience, the early signs for them were subtle, and it was difficult to tease apart and describe the changes so their doctor could assess whether it was something more than simply age-related memory decline. Looking back, she could see that for her, the rail lines began to sing years before her husband received his diagnosis. Even in the earlier stages, the presenting symptoms are related to physical changes in the brain and are not within the control of the person experiencing the changes. So, in the early stages of dementia or mild dementia, changes are already beyond what would be considered normal age-related memory decline, and the symptoms are beginning to have an impact on the person's daily life. Returning to the three-stage progression model we looked at before, we'll go through each stage considering changes in 4 areas: mental, emotional, behavioral, and physical abilities. These are common symptoms. I'll highlight yet again that each individual with dementia will be different and not necessarily experience every symptom that's to follow. In the early stages of dementia, the symptoms you'll see will be quite like the warning symptoms previously mentioned. Forgetfulness that goes beyond forgetting the occasional appointment, the name of the neighbor who lives down the block, or a friend's phone number. The things that are just at the edge of our consciousness and make us go, ah, yes, of course, when we're reminded, or that pop into our head once we've already started thinking about something else. Someone living with dementia may forget things more often and not remember them later, especially things that have happened more recently, like spending an afternoon with a friend the day before. Misplacing things can be a common symptom that accompanies this. Changes can also include having a difficulty with limited attention span, difficulty learning new things, and difficulty with communication, like finding the right word. This is where you might see the word substitution or talking around words that was mentioned when we were looking at the warning signs. These changes can make someone's sentences difficult to understand, and they might have a difficulty following conversations, especially when someone is talking quickly or there are multiple people talking at the same time. Difficulty with orientation or getting lost on familiar routes can be another symptom you might notice at this stage. Emotionally, moods may start to shift easily, and you may notice a loss of interest in social activities. The person with dementia may initiate activity less often, but will generally be interested in participating when they're set up for success. We've heard from some people living with dementia that they feel they are being judged as being lazy, but it's particularly important to understand that this change is likely because of damage to a part of the brain, the frontal lobe, that switches us on and allows us to activate ourselves. Sometimes it's just a matter of needing help getting started. Behaviorally, you might see passiveness, withdrawal, and restlessness. And physically, you might begin to notice mild coordination problems, like stumbling more often or falls, and things like hand-eye coordination challenges. In some cases, you might notice a change in gait. We often hear care partners say the person they're supporting is doing great physically, but it's just their memory. Physical changes are part of dementia, even in the early stage. It's also really important to consider how care partners may experience changes in each of the 4 categories through the different stages. While one person receives a diagnosis, dementia really impacts the whole family. Early on, care partners may notice changes in their own memory. So often we're asked by care partners, is this contagious? Because I feel like I'm losing my own memory. No, it's certainly not contagious. However, the stress and grief of watching your family member change in this way can have a profound effect. The strain of having to remember for 2 also often takes a toll on the care partner's memory. The unpredictable roller coaster of changes that dementia brings can be particularly difficult on care partners. Shifting moods, abilities, and awareness can leave care partners feeling overwhelmed. You may feel worried about what the future can bring and experience some anxiety and depression yourself. Frustration is a big experience that can be very present for both of you. Care partners can experience increased stress and fatigue while trying to accommodate changing symptoms. As a care partner, you may notice new demands on your time and attention, which can manifest in an irritability, lack of patience, and trouble sleeping. Typically, for someone in the middle stage of dementia, there is an increasing loss in cognitive and functional ability. Many people in this stage still have some awareness of their condition, but this is also a time where some people who had insight into their condition lose this insight. In the middle stages of dementia, people commonly experience the following symptoms. Mentally, you'll likely see continued and intensified memory problems. Problems with abstract thinking, like making sense of symbols and images, including money, math, or understanding metaphors like, it's raining cats and dogs outside, which, of course, makes no sense if taken literally. Language difficulties will increase as well. Visual spatial problems can occur in this stage, and some people may become confused around time and place. This can mean someone is at risk of getting lost, even in a very familiar environment. Someone might leave their apartment and have difficulty knowing which one is theirs to return to, or someone might even become disoriented in their own living space. Emotionally, you may notice personality changes, which can appear as an increase in anxiety, suspicion, anger, or sadness. It could also mean that someone actually shifts to a happier, more relaxed personality. Motivation is often increasingly affected in the middle stage, which may mean a decrease in performing tasks or responsibilities held before, engaging in activities that once brought pleasure, and participating in social activities. For example, someone might have loved going to bingo several times a week, but now refuses to go, fails to initiate contact with friends, and declines invitations. Behaviorally, there's often declining ability to concentrate on things like watching a movie, which requires over 90 minutes of mental focus to follow a plot and keep track of characters. Rather than following along with the news or tracking a storyline, someone may have much more success taking in content without a plot, like watching a nature show. Or perhaps someone has always been really interested in sports. They may not be able to keep track of the game and outcomes, but still really enjoy it in the moment. Some people even enjoy watching the same games over just for the pleasure of seeing the play. Someone may experience an increase in restlessness, such as pacing and wandering and needing to go somewhere, get out, do something. Repetition can increase, asking the same question multiple times, telling the same stories, or rewashing dishes that have already been washed. You may also start to see an increase in delusions, which are false beliefs or stories. For example, someone might be convinced money or items have been stolen, or accuse a partner or spouse of having an affair. Social filters and aptitude can also be affected. The part of the brain that tells us how to behave appropriately may have stopped working. Someone may say or do things that are not appropriate for the social setting and quite out of character. And physically, increasing assistance will likely be required for daily tasks like dressing, bathing, and toileting. Appetite might fluctuate, and sleep patterns often become disrupted. Someone might need more sleep or may start waking up in the nighttime more often. Sometimes there are changes in behavior that include physical and emotional outbursts, anger, or frustration. This can be a big fear for some people, as it's common to have heard about scary situations happening when dementia is present. While this can happen, it's really important to note that it's not guaranteed to happen. Understanding this is an essential part of reducing the stigma that can be associated with dementia. It's good to be aware of the possibility of these challenging behaviors, to know what to look out for, what might be triggering the behavior, strategies for responding, and how to get help when needed. But it's not necessary to be scared. The Alzheimer's Society has some great handouts on behavior, and behavior is discussed extensively in several recorded videos. For our purposes in this session, it's just good to remember that the brain is struggling at the middle stage, and changes in behavior will be happening. For families and care partners, the middle stage is the point where their need for involvement is likely to increase substantially. This is often the time to involve community support services for help. If you have any questions about the process for engaging supports or how to get started, please call us. We are here to help you get the information you need on changes you might be noticing and how to access community supports. During the middle stage, responsibilities will increasingly shift to the care partner, and while planning together should remain the aim, the care partner will often need to start taking a lead in decision making. As we've covered, a lot can be happening in the middle stages of dementia, and it can be a steep learning curve for caregivers. It can be draining. Someone might find themselves increasingly thinking, doing, and organizing for two people. Knowledge is power at this stage, and we are here to help with workshops, support groups, and phone calls. Care partners are likely to experience a roller coaster of emotions throughout the dementia journey, and the middle stages are certainly no exception. The person living with dementia is changing, and care partners are having to change too. Care partners can find it difficult to sleep and rest. they are likely being pulled in many different directions. The middle stage can be the longest stage and the stage with the most change and challenge. Sometimes talking through these situations with other care partners or having a private conversation with one of our staff members can be helpful. Often, if someone hasn't been ready to engage with our sports before, this is the time to get started. We hope you will reach out to us and learn more about how to do this. In the next 2 slides, I'll be talking about some of the symptoms that can happen in the late stages of dementia. This can be difficult to hear about, and if you don't feel ready to learn more about this stage, that is absolutely okay. Returning once again to our mapping the journey analogy, some people might want to examine the full map of Canada before starting out on their trip. Others may prefer to plan their way to, say, Ontario, and then look ahead to the last legs of the journey when they get there. Neither way is right or wrong. The information will be available to you when you are ready. You can revisit this webinar when you're ready to learn more, take a look at the resources available on our website, or call the First Link Dementia Helpline. If you'd like to skip the discussion of the following symptoms, you can jump the video ahead to the slide titled Keep in Mind. By the late stages of dementia, the brain has become significantly impacted by the disease someone is living with, and the changes are much more severe. There will most likely be short and long-term memory loss and a marked decrease in the ability to process information. There's much more severe impairment in communication, often with speech being very limited, or in some cases, non-existent. There may also be intense confusion about time, places, and people. For example, in late stage, someone may no longer be able to distinguish the difference between a 10-minute visit and a 3-hour visit from a loved one. And although they might visit regularly, the memory of them being there might not be accessible at all. Someone in the late stages of dementia might have profound difficulty expressing emotions, even when they're experiencing strong feelings. This is a time when body language and facial expression will need to be relied on to understand what someone might be experiencing. Someone may become further withdrawn. Touch and nonverbal communication from the care partner as well becomes much more critical. Someone in the late stages is very likely to need to sleep longer and more often. They may be unable to walk independently or at all. There can be weight loss associated with difficulty eating or swallowing. There is usually a loss of ability to dress and bathe, and a loss of bladder and bowel control can be common. While many people with dementia die of other comorbidities or health conditions like pneumonia or heart failure, the deterioration of the brain will eventually shut down a person's body over time. Teepa Snow, a renowned dementia advocate and educator, has described the stages of dementia as different gems, from diamonds in the early stages with clarity and some sharp edges to a pearl in the late stage. The person is still there, and there can be beautiful moments and glimpses of who they were before. But for much of the time, the shell might be much more visible than the pearl. With good care, there can be more opportunities for the shell to relax so the pearl can be visible inside. For care partners, your role changes yet again, and you are now most likely working with a team of medical professionals. You are still captain of the ship or the one behind the wheel, but you may not be doing all of the day-to-day care needs for someone in the late stages. You continue to be an advocate, as the one who knows the person you're supporting the best. When the person with dementia is likely no longer able to communicate their needs or fully represent who they are to the world, as a care partner, you are now the one who can share valuable information about the person's personality, along with their likes and dislikes, to help ensure person-centered care with dignity and respect. You can give a holistic picture of who the person with dementia is. For example, a father, a businessman, soccer coach, an avid gardener. Whomever they are is now communicated to the team by you. There is likely some guilt and further grief experienced as you require a more medical model of care now. Continued progression of the disease and changing ability for self-expression likely means the caregiver feels even more disconnected from the person they're supporting. And now there can be a physical loss with a possible move to long-term care. Some care partners have expressed they feel some relief with knowing there is 24-hour help from nurses and care aides, and you can now return to more of your previous role as the child, spouse, or friend. You may also need to seek out further support from hospice or palliative care teams for these difficult final stages of the disease. I'll give you an example of a husband and wife connecting at the late stages of her dementia. Fatima has now moved into a long-term care setting. When her husband Hassan visits, he holds her hands and talks of the times they shared together in the past to see if she can join him in that memory. He often brings a favorite treat and they eat together with a cup of tea. Some days he gets a smile or a word or two from her, but other days he does not. Hassan makes sure to show his love while he's there. And research shows that while Fatima can no longer remember the visit they had together, the feelings she experiences during the visit stay with her long after he leaves for the day. Now, it's important to keep in mind that these scales represent a general description of patterns. They are not specific to individuals. Again, if you've met one person with dementia, you've met one person with dementia. Symptoms can differ from one person to the next, and individuals rarely move precisely through these stages. Some early stage symptoms can begin in mid stages for some people, or for some individuals, a typical mid-stage symptom may appear in the early stages. It really depends on where the protein deposits or vascular changes are causing damage in the brain. Symptoms can even vary day to day. People have good days and bad days. We may see what appears to be progression seemingly reversed the very next day, or we may question whether the dementia is progressing at all in the wake of a number of good days. And the decline will look different depending on the exact form of dementia. For example, it's common for people with dementia with Lewy bodies to have fluctuations in their cognition while their memory may remain relatively unaffected. People with Alzheimer's disease tend to decline slowly and steadily, whereas with vascular dementia, the decline can appear to be more stepwise, with notable decline followed by plateaus depending on how often and where the strokes occur in the brain. So again, these stages are not exact. It's not possible to estimate the time it will take to move through the stages or the life expectancy of someone who is diagnosed, since it varies so widely from person to person. There are many factors that affect progression, including other medical conditions that the person is living with at the same time as dementia, as well as the length of time of the disease that may have been present prior to a diagnosis. Living well with a serious disease at each stage is not easy, and there will be good days and bad days for you both. It is a shared journey that can have learnings and moments of deep connection throughout the stages. And the Alzheimer's Society is here for you throughout the journey to help understand the changes, navigate the system, and plan for the future with education, support groups, and the First Link Dementia Helpline. You are not alone. And here is the information for the helpline. If you have questions about information you've heard here, or any other questions about living with dementia, or if you'd like to discuss Alzheimer's Society programs and services, please don't hesitate to call our First Link Dementia helpline. English services are available Monday to Friday from 9 a.m. to 8 p.m. Pacific Time at 1-800-936-6033. Services are also available Monday to Friday from 9 a.m. to 4 p.m. Pacific Time in Punjabi, Cantonese, and Mandarin. You can get information on how to connect with non-English services by following the web address provided on the slide. Please also take a look at the video description to find a link to the helpful resource guide associated with this webinar. Thank you for watching.